Welcome to Central California Alliance for Health's video on how to prepare for a facility site review. I'm a quality improvement nurse with the Alliance, and my job is to review your site and your processes with the goal of ensuring that Californians have access to high-quality health services. We have created this video for those of you who are new to the review process or require an assist to improve your site review results. We hope you find the information effective and useful in helping you to be successful in your next review. What is the purpose of a facility site review? California law requires Medi-Cal managed care plans, such as the Alliance, to have adequate facilities and service site locations available to meet contractual requirements for effective family care within their service areas. To monitor compliance with all applicable state as well as local federal laws and regulations, plans are required to conduct facility site reviews, monitoring, and medical record reviews at their clinical sites using the Department of Healthcare Services FSR and MRR tools and standards. The site review process is part of the plan's quality improvement programs that focus on the capacity of each PCP site to ensure and support the safe and effective delivery of appropriate clinical services for the members. Primary care sites will need to pass their review, and if given a corrective action plan, will need to complete it in a given time frame to qualify for credentialing and re-credentialing.
In this presentation, we will provide you with tips on preparing for your facility site review, what to expect, and information on how and where to access resources.
What are the different types of reviews? All site reviews are mandated by DHCS to be conducted within given timeframes. Most of the reviews are scored. Those that are not are either for monitoring purposes or information shared with the members. If a certain amount of deficiency is found during the scored or monitoring reviews, a corrective action plan or CAP will be given to you for your site to implement recommended improvements and submitted back to your Alliance nurse reviewer within timeframes established by DHCS. Initial review. This is conducted prior to the opening of a new site, a site expansion, or move to a new location. The results of this review will help determine if your site will be approved for credentialing and have members linked. Periodic review. This is conducted at least every 3 years to assess for regulations, compliance, to re-credential your site, and provide updates and education. Monitoring review. This brief review occurs between periodic reviews to assess for critical safety matters that can adversely affect patients. The review can consist of a self-evaluation form for you to fill out and send back to your Alliance nurse reviewer, or a site visit that may also include updates and educational materials. Pre-site. This is an unscored and optional review that is offered prior to a scored review, so you may benefit from additional support. Another benefit of a pre-site review is that it decreases the likelihood of receiving an FSR CAP. A pre-site review may be requested or offered if indicated. Physical accessibility review. This is a brief unscored review that evaluates your site's level of accessibility for seniors and persons with disabilities. The results are made available to members through the Alliance website and provider directory. To allow time for you to prepare, about 7 to 8 months prior to the due date of your periodic review, you will get an email reminding you that a state-mandated review is coming up soon. You will also be given the DHCS survey tools to help you to prepare. Months later, you will be contacted again to schedule a review date.
When setting a date for the review, anticipate it taking 1 full day, up to 2, dependent upon how many medical records that will need to be assessed. The minimum number of medical records assessed is dependent on the number of full-time equivalent primary care providers at your site. Please be prepared to provide this information prior to your review date.
On the day of the review, we will ask you questions and tour your facility. The questions we ask and the items we look for are in the following categories. Access and safety. We will assess the facility's parking, building accessibility, and check that the environment has the items required to be safe for all patients, visitors, and staff. Personnel. We will assess for current licenses, certifications, non-physician medical practitioners agreements, training and safety measures, and members' rights. Office management. We will assess provider coverage, timely access to care, referral processes, interpreter services, grievance procedures, and HIPAA compliance. Clinical services. We will check pharmaceutical-related items such as personnel training, drugs and medication supply, storage of medications and expired medication maintenance and disposal, handling and storage policies, as well as the procedure for how medications are dispensed, administered, and documented. Laboratory. We will assess compliance with CLIA regulations, personnel training, lab supply storage, maintenance, and expired supplies maintenance. Preventive services. We will assess for member health education materials and examination equipment such as scales, measuring devices, exam tables, stethoscopes, otoscopes, ophthalmoscopes, eye charts, audiometers, and others. Infection control. We will check that infection control procedures for standard universal precautions are followed, that policies or procedures are in place for isolation of infectious patients, compliance with OSHA bloodborne pathogen standards, biohazardous waste management, disposal, and storage, needle stick safety precautions are practiced, and incidents are documented. Pharmacy. If pharmacy is on site, we will assess for the pharmacy license and other pertinent information. Radiology. If you provide X-ray services, we will review that the site meets California Department of Public Health radiological inspection and safety regulation. We will also speak to staff members and interview them regarding policies and procedures at your site.
For a more efficient review, we recommend sending via fax or email information requested for personnel and training a week or two prior to your review. This may help shorten the review time.
During the audit of your medical records, we will assess patient charts for format. This entails patient demographics, identification of an emergency contact, member assignment to a PCP, patient preferred language, need for interpretation documented, signed notice of privacy, and medical record release form. Documentation. We will look to see if allergies, chronic problems, and continuous medications are noted and current. We will look for consent forms. All chart entries are signed and dated, and errors are corrected according to medical document standards. Coordination of care. We will assess history of present illness, reason for visit, working diagnosis, and that treatments are consistent with findings, evidence of a provider review of reports and specialty consults, evidence of patient follow-up with referrals and missed appointments. Pediatric, adult, and OB preventive measures. For these three, we look for a comprehensive history and physical, the use of an individual health education behavior assessment, or the IHEBA, such as Bright Futures for Peds, and the Staying Healthy Assessment, or SHAW, for peds, adults, and seniors. We will assess for preventive care as recommended by the American Academy of Pediatrics, United States Preventive Services Task Force, the American College of Obstetricians and Gynecologists, Advisory Committee on Immunization Practices, as well as other agencies with panels of national experts in prevention and evidence-based medicine.
To reduce time of your review, with approval to access your electronic health records remotely, your nurse reviewer can audit your patient charts prior to your review and discuss the results on the day of your site review.
To keep your staff information organized and readily available, it is recommended to keep files for each of your site's employees in either paper form or electronic.
DHCS requires the following information to be maintained. Personnel. Current licenses of all providers, specialists, pharmacists, and nurses. Current Drug Enforcement Association license and evidence of training documents. For non-physician medical personnel, if you employ an NP, provide a copy of their standardized procedures. And for PAs, provide a copy of their practice agreement. For non-licensed staff, a diploma or certification from an accredited MA training program or school, or written documentation that the MA demonstrates proficiency to perform duties within their scope of work by stating the location, content, duration of training, and assigned and dated by the current supervising physician. It is also required that you have evidence that the staff has appropriate training in medication administration, lab procedures, use of equipment, and other duties to ensure safety for patients and staff. Training policies and procedures.
It is recommended to keep policies, procedures, and all learning resources organized together. For example, use binders or organized electronic files for all education offered to staff. If using a training site with modules, keep a list of the module descriptions that equate to the state-required training.
For each training session, maintain meeting agendas, training information content, and evidence of training, which can be forms with staff members, printed names, title, signature, and date of completion. Keeping binders and folders of staff information, training, policies, and procedures not only keeps your site's information organized and easily available for you and your staff, but is evidence of compliance and of your hard work in keeping your staff safe and educated as they care for their patients.
The Alliance website includes FSR sample documents that you may access and customize for your site.
How do you keep your staff's information, evidence of training, policies, and procedures organized?
We have a shared drive or a shared folder in the shared drive within the organization where we have been able to document and put all of our policies and procedures in place, all of our evidence of staff education and training. We also have an application titled MedTrainer that allows us to be able to file all of our staff and employee education and training and have it accessible to all of the managers. Whenever we do need it, we're able to run reports from that. We've been able to create folders specific to the facility site review categories and being able to have it accessible to everybody that would like to, that is part of the facility site review process. So we're able to have that readily accessible, and our credentialing and licensing department is able to maintain that folder as well. In that folder, they're able to keep all of our licensing and credentialing information, so that's accessible to anybody that needs it whenever we have a facility site review coming up.
This is a list of the DHCS required training for providers and staff. Infection control universal precautions conducted annually. Biohazardous waste handling conducted annually. Bloodborne pathogens exposure prevention conducted annually. Child, elder, domestic violence abuse. Patient confidentiality. Informed consent. Prior authorization requests. Grievance complaint procedure. Sensitive services minors' rights. Health plan referral process procedures, resources. Culturally and linguistically appropriate services. Fire safety and prevention. Emergency non-medical procedures such as site evacuation, workplace violence, earthquake, and others. Medical emergency procedures. Use and maintenance of medical office equipment. Demonstration of accurate collection of vital signs. Demonstration of accurate injection techniques. Use of the oxygen tank.
In preparation for your review, check to see if you meet all requirements by using the DHCS FSR auditing tool. Set aside time quarterly, biannually, or yearly in your schedule to review each section of the tools to ensure that your site is in compliance. Also, conducting an FSR assessment prior to your annual training sessions with your staff will ensure you are able to identify items that may need to be updated, require additional training materials, or reinforcement.
How do you make time to prepare for a site review?
To make time for site reviews, we ensure that everybody essential for the site review is available. The QI and QA department does do a lot of coordination between HR and medical records to ensure that the documents that are being asked for are provided to the site review, to the auditors in a timely basis. Year-long, we do some quarterly audits to ensure that the facility is up and running based off of the guidelines. And The quality assurance department and the quality improvement department are run by directors, and under them, there's actually coordinators that work together to ensure that these pieces all fall together.
What are the most common deficiencies found in FSR? Lacking evidence of training, cultural and linguistic information. Lacking evidence of emergency medications for management of asthma, chest pain, hypoglycemia, and anaphylactic reaction on site. Lack of written site-specific policy procedure for dispensing of sample drug. What are the most common deficiencies found in MRR? Blood test not completed at 12 months and 24 months, or catch-up blood test by the age of 6 years by those not tested. Patient's dental home not established and documented by 12 months of age. Adult immunizations are not reviewed or offered at each health assessment visit.
What are some resources to assist us in making changes? The Alliance website has FSR resources that you can customize to assist you in attaining compliance. Consistent with the Central California Alliance for Health's mission of accessible, quality healthcare guided by local innovation, practice coaches from the Alliance Quality Improvement and Population Health Department work with our network primary care practices, identifying solutions to produce positive outcomes for our members. As we work to advance our vision of active leadership in achieving healthcare solutions, we want to actively engage with and support individual clinics in QI work. Specifically, we seek to partner with our providers to pursue the quadruple aim: improving the health of populations, enhancing the experience of care for individuals, reducing the cost of healthcare, and attaining joy in work.
How can I access the materials to assist me with my review? You can access the Alliance website for resources. We also encourage the use of the provider portal, which contains valuable information and updates for your specific site. If you need information on your login and passcode or a tutorial, please contact your provider relations representative.
I know I must complete and pass an FSR and MRR to recredential my site, but is there any other benefit to it? The Alliance has a care-based incentives CBI program. The CBI program consists of a set of measures to encourage preventive health services and connecting members with their PCPs. The program offers financial incentives as well as technical assistance to PCPs to support providers in assisting members to self-manage their care and reduce proximal healthcare costs in the following areas. Improve quality outcomes, as reflected in part by healthcare effectiveness data and information set scores. Improve member experience. Encourage delivery of high-value care. Improve patient access to primary care. Encourage the use of disease registries to address population health. Encourage adoption of best practice care guidelines, as recommended by U.S. Preventive Services Task Force. Reduce disparities in quality or service delivery between groups of members and/or geographic regions.
For more information, see Section 18 of the Alliance Provider Manual or our website. Quality improvement coordinators can also assist you in improving your CBI outcome. Throughout your process of preparing for your facility site and medical record reviews, don't hesitate to ask for assistance from your Alliance FSR nurses, practice coaches, and provider relations representatives. We are all here to provide you with information, resources, and the support you need to be successful. Thank you.